Welcome to Eyecare Today. This is Dr. Belanger. We're here at Stroudsburg Eye Specialists in Tannersville, Pennsylvania. We have a very special guest today, but first, I want to tell you where we're located in Tannersville, Pennsylvania at Stroudsburg Eye Specialists, right next to the Friendlies. You can reach us at 570-421-3342. We also have our office in Hazleton on Airport Beltway. Big eyeballs on the building, so you can reach us there at 570-453-2020. And two of our newest offices, one being in Pottsville and our Nanticoke office, which used to be known as Evans Eyecare. So you can always go on to www.drkislin.com to get more information about our locations. We have a very special guest today. Her name is Jennifer Mirocha, and she's from Cooper Vision. She's a myopia management specialist, and we're very excited to have you on today because she has a ton of information that's very important. So I guess first off is, what is myopia?
So myopia is a progressive eye disease, which is often referred to as nearsightedness. And when a person is nearsighted, it means that they cannot see objects in the distance clearly. And the reason for this is because the eye is growing too long and too fast.
So I think this is always a confusion amongst people, is nearsightedness versus farsightedness. So nearsightedness is when you can see here, but you can't see far away. And I think inevitably we are becoming more nearsighted because this is where our life has been, is up close. With the new onset of devices and cell phones, I used to work with a lot of veterans at the Veterans Hospital, and it's interesting that you didn't find it. It was rare to find a nearsighted vet. They were all farsighted. So this is really becoming an increasing problem. I know that within my practice, the majority of the young children that come in are nearsighted and not farsighted. So getting outside and children being outside and having outdoor time is great for the eyes. I mean, it's also great to have that interactive outdoor play amongst children. It's just not seen as much. You know, you used to be able to drive down the road and see kids playing outdoors, and it's rare. I always smile when I see that because it's just so nice to see these kids outside playing. But in fact, that vitamin D plays a huge role in the progression or the preventative measures of myopia. And like you said, the devices. I always have parents come in and they say, you know, my kids are on the screens all the time, and what can that do to their eyes? And there's a ton of things that this can do to their eyes, but I always tell them also their brains. So anything up close, we're not going to be able to prevent doing up close work. You know, that's going to, you know, we're in a society where we have children in school, we have children on computers, we're trying to use these, but I think we have to try to limit these device uses to tools. So not a constant device, right? Not a constant up close work. And you know, as far as the vitamin D and getting outside, in addition to vitamin D and being outside, when you're outside playing, you have a longer distance. Your eyes are looking farther away. They're not stuck at this up close. So this plays a very important role in the myopia progression.
Absolutely.
What in the long-term implications of having myopia, does that cause any diseases that you can be more susceptible to?
Absolutely, because the more myopic a child becomes, the more at risk they are for things like myopic maculopathy, glaucoma, cataracts, and also retinal detachment, because, you know, as the eye is growing longer, it is growing weaker, both optically and structurally.
Right. So if we can do things to reduce myopia, we can essentially set people up for long-term success in that they'll have a much less risk of these things. As you said, glaucoma, cataracts, retinal detachments, retinal tears, and different types of maculopathy that can affect the retina. So this is a very important conversation to be a preventative measures. So we are going to talk to you about what we have and what's new from Cooper Vision, and this is a great preventative measure for myopia. I know for my young children, I will be, watching, that they limit their screen time and their device time, their up close time, as well as get outdoors and have that outdoor play. So when we come back, we're going to talk to Jennifer about what Cooper Vision has done to help slow down the progression of myopia. This is a very exciting conversation. Welcome back. I'm Dr. Belanger, and we are here in Tannersville, Pennsylvania at our Stroudsburg Eye Specialists location. You can find us on Route 611 next to the Friendlies in Tannersville, 570-421-3342. We also have our office in Hazleton on the Airport Beltway. You'll see a big eyeball on that building, and that's how you know it's us in Hazleton, 570-453-2020. And two of our newest locations that we're very excited about, one in Pottsville, Pennsylvania. You'll see Pottsville Eye Specialists, and then our very new office in Nanticoke, Pennsylvania, formerly known as Evans Eyecare, and we are really excited about that location and seeing people of that community. So with us today, I have our Cooper Vision myopic management specialist, Jennifer Mirocha, and we were just talking about myopia and nearsightedness and how it's becoming a problem, and the reason it is becoming a problem, especially in children. So Cooper Vision, they're very exciting, a great company. It has created the first and only FDA-approved contact lens that can slow down the progression of myopia. So can you talk to us about this program and this contact lens?
Absolutely. So MiSight One Day is the first and only FDA-approved treatment to slow the progression of myopia in children on average by 59%. And MiSight is a convenient, daily disposable contact lens.
And if a child is fit in this contact lens, it is going to help them not progress in their nearsightedness. Is that correct?
Exactly. So essentially what the MiSight One Day lens does is it slows down the growth of the eye, in turn slowing down the prescription from changing.
So it's important to note that the nearsightedness is caused by the elongation of our eye, and this is typically a progressive process that the eye is elongating by factors like we talked about, lack of outdoor time, lack of vitamin D, increased near work. So these things are elongating the eye, and this contact lens that the children can wear is placed on the eye and worn, and it's going to slow down that progression.
Yes, and this is actually a dual purpose lens because while slowing down the growth of the eye, the contact lens is also correcting the child's vision at the same time.
So I think that's fantastic for us to be able to fit children in contact lenses and correct them, right? We're actually going to correct their prescription, so they'll be able to see clearly out of this contact lens. But this contact lens is essentially treating and managing the progression of myopia. So this is huge. At least in my practice with seeing a lot of pediatric patients, we're going to be able to fit this lens and really, help these children. This contact lens is, again, having that dual purpose. So we're going to correct your vision and we're going to slow down myopia. And I think that's fantastic. And the studies have been super promising.
And honestly, Dr. Belanger, this can be a life-changing treatment for these children. When we look at this in terms of slowing down the progression by 59%, this is more than half. So this could be the difference of a child walking to the bathroom in the middle of the night with or without their glasses. So this really is exciting.
It's very exciting, and as we talked about the different eye diseases that can follow with having myopia, by being able to slow down the progression for these children now, it's actually setting their future up for better success, in that they will have less chances of retinal detachments, they will have a lower risk of glaucoma, they will have a lower chance of cataracts, especially at a younger age for cataracts, and a much lower risk of myopic maculopathy. So this is fantastic. Especially in the eye care world, this is huge for us. We are very excited about this here. I know that Dr. Diem, he is certified to fit this. Dr. Saran, she's in our Pottsville and Hazleton office, she's also certified to fit this lens. So we are really going to be utilizing this within our practice. When we come back, we're going to talk to Jennifer about how your children can use the MiSight contact lens. Welcome back. We are here with Jennifer and we are discussing the MiSight contact lens. But first, I want to make sure you know where we are located. So in Stroudsburg, Eye Specialists, actually in Tannersville, Pennsylvania, next to the Friendlies on Route 611. You can find us right down from the Crossings outlets, about 5 minutes, 570-421-3342. We also have our office on the Airport Beltway in Hazleton. You'll see a big eyeball above the building, and you can find us there at 570-453-2020. And our two newest locations in Pottsville on Bacon Street, we cannot forget that one, and in downtown Nanticoke on Prospect Street. So we're very excited for these 4 locations, and the good thing about having all these locations and so many doctors is anywhere you're at, you can come down and bring your kids down to get fit in the MiSight contact lens. It's been shown to be very promising to help slow down progression of the myopia. So how effective is this contact lens at slowing down progression of myopia?
So in the 7-year clinical study that Cooper Vision did for MiSight, we found that the children who wore the MiSight lenses for the full 6 years all progressed less than 1 diopter over that time.
That's huge. I have children coming in, and they are every year they're progressing more and more. Every year their parents are asking me, what can we do? And I think this is just such a great option to help them with that. So how would a child use the contact lenses?
So in order for the MiSight treatment to be effective, the child does need to wear the lenses 10 hours a day and 6 days a week.
Once they take their contacts out, they can wear their glasses.
Absolutely.
Okay. And how safe is this for these children?
Wearing MiSight lenses is very safe for children. We've found that 9 out of 10 children, all the way as young as 8 years old, can successfully apply and remove the lenses all on their own.
Wow. So starting at such a young age, we can help these children to become less nearsighted, which is just, I think it's phenomenal. How about as far as hygiene, safety as far as hygiene?
So that's the great thing about MiSight, Dr. Belanger. It's a daily disposable lens. So every night the child takes the lens out, throws it away, and opens a new pair every day.
I think this is really important because in our practice, now that we have daily disposables on the market, it's what we really push for children to be in because of the hygiene. So the MiSight is daily disposable. There's no case that they have to store the lenses in. There's no solution. As soon as they come out of the eyes, they can throw them in the garbage and open a fresh pair the next day. This is going to definitely reduce the risks of infection and corneal problems that can come with it. So that's very exciting. And where can we find more information for people interested in the MiSight contact lens program?
So we have some great educational content on mysight.com. We also have some great educational videos on YouTube. So definitely take a look at the MiSight YouTube channel, mysight.com, and you can also find us on Facebook or Instagram as well.
And I just want to mention that's MiSight as in M-I. So if you're looking up information, make sure you're searching it correctly. This is very promising for kids' futures, and I think the benefit is getting children in for eye exams at a young age. We see children of all ages here. I'm always pushing pediatrics at our office, and we want children to have eye exams as young as possible, okay? And that we can find myopia younger, and we can treat this, and we can get children in a contact lens that's going to help slow down the progression of myopia and take down the risk of long-term effects. And we talked about those as retinal detachment and glaucoma and cataracts. This is a very promising treatment. We're very excited about this. So I'm assuming, Jennifer, that treating early would be, the most successful for these children.
Absolutely. The earlier we treat the child, the bigger the impact we can have on the long-term outcome of their myopia. So essentially, children progress faster and they progress more at a younger age. So we really want to treat them as young as possible.
So as we find nearsightedness in the practice, the younger they are when they're diagnosed with myopia, the more likely they are to progress much quicker. So that's really important, and really important for parents to know that you come in and asking, parents and grandparents, you come in asking, how can we protect my children's eyes? How can we protect them from the future, or for future problems? I have parents asking about the blue light, and this is something that is not stressed enough. The myopia progression is going to lead to a higher risk of so many long-term things on our eyes, so many long-term diseases on our eyes, and that's really important. So you can find us here. I am certified to fit MiSight, and you'll find me at Stroudsburg Eye Specialists in Tannersville. We have our Hazleton office on the Airport Beltway, and we have Dr. Kislin, Dr. Diem, Dr. Connors, Dr. Saran at that location, who are certified to fit the MiSight lens. So if your children, your grandchildren, anybody you know who is constantly needing to update their glasses, and every year they're becoming more and more nearsighted, come in, get your eyes checked, get an eye exam, and talk to our doctors about the MiSight program. And I want to mention that you can also be seen at our Pottsville and Nanticoke offices. So we're happy to see you, and I want to thank Jennifer for coming on today and talking to us about this. This is such an exciting time for eye care. So thank you.
Thank you so much for having me, Dr. Belanger.
And we'll see you next time on Eye Care Today.